there is no uniform response. CMS many moons ago, came up with guidelines, and they're guidelines for the entire United States. But guidelines are not the same thing as mandates. And so it was up till now, and is including now, up to every individual institution or healthcare system to decide for themselves what and if and when they would implement these guidelines. It is not uniform, and nor is it mandated that they need to share their data. So it's impossible to say what everyone is doing, and places that are, again, going back to those low-resourced areas, they don't necessarily have the capital to come up with a really solid prevention, emergency preparedness plan. That question really speaks to the need for a holistic view of healthcare. So with that, you need to look at the individual patient, you need to look at the healthcare workforce, which is also impacted, and healthcare systems as a whole. So once again, and I hate to keep saying this, it is such a complex, tangled problem that needs to be gently untangled, and each part needs to be looked at individually as to what their needs are. Specifically though, if I had to talk about some particular interventions, I would say healthcare systems really focusing on mitigating, like we talked about, interruption in care, and what does that look like in their region of the country? What does that look like with their the populations that they are servicing? That looks like healthcare systems looking at advanced coordination and planning. We historically look at emergency preparedness from a retrospective angle, and what we as oncology nurses are now saying is we need to anticipate what's coming, because the science has already told us what's coming. And how does that translate more specifically to my specialty in oncology? What does that look like for my patients? And that, again, even within that, is not a cookie cutter response, because my patients that are being treated for lung cancer have different needs than those being treated for, any other cancer. So each population really needs to be looked at individually, and so institutions need to implement that advanced coordination of care, that anticipatory coordination, and planning for their workforce needs. How in a hurricane situation have you planned out for your employees to be able to get to work, or going back to that hospice example, how can you assure that they're able to get out into the community in home care? And really have a contingency plan for allocation of resources. Again, we historically look at things retroactively or at the moment, and we no longer have that luxury, and in fact that was a luxury. So we know now, we know what we need to do, and we need to do better.